Hello, good evening, everyone, and welcome to our 50th Salon, our 50th anniversary Salon webinar. Can you believe it's been 50 episodes already? I'm Adam Smith. I'm delighted to be your host for today's session on a topic that touches all of us, nutrition and brain health. Now, when we think of dementia research, we often jump straight to genetics or imaging or molecular biology. But what we eat and how our bodies respond to nutrition across our lives is increasingly recognized as a key piece of the puzzle. So today we're asking, can nutrition help prevent cognitive decline? Can diet actually play a therapeutic role in dementia care? And how can researchers better understand this often overlooked connection? To help us unpack this, I'm thrilled to be welcomed by two brilliant researchers who are both going to turn their cameras on. They're being shy. We have Dr. Raysa Zein from the University of Westminster, who has been on our podcast before, has been to the Salon before as well. It's a pleasure to have you back, Raysa. Raysa is a public health nutritionist and a researcher at the University of Westminster, focusing on dietary ketosis and memory loss. Hi, Raysa. And we have also as well, for the first time in the Salon, we have the brilliant Dr. Vanessa de la Cruz-Góngora, who from the National Institute of Public Health in Mexico and a former Global Brain Health Institute fellow from Trinity College Dublin as well, with a fascinating focus on aging, micronutrients, and the impact of nutrition on cognition in older adults. Thank you both for joining us. For those that are new to the Salon, I know looking down the names of attendees, I know most of you have been here before, but just to explain how this works is Vanessa and Raysa will each take turns giving a 10-minute talk. They've had very little briefing in advance of this other than to say, hey, you've got a free rein, talk about this topic and share your interesting facts with us. So I'm fascinated as you are to hear how they're going to talk to this topic, but each of them will talk for 10 minutes. Then we're going to have a chat and ask some questions. And at that point as well, we'd love to hear from any of you. If this is also your field of research, we're very welcome and delighted to invite you onto the stage as well to join us on camera and share your own experiences. Or if you're a little bit shy, you can also just chat away in the discussion area, and do use the Q&A button at the bottom of your screen if you're on the website, or at the top if you're using the app, to ask your questions as well, and I'll make sure that Vanessa and Raysa can answer those. But that's enough from me. I think Vanessa is going first. That's right, isn't it? Yes, Vanessa.
That's right.
Over to you.
Thank you so much for the invitation. And this is my first time, so I have to make the expectation. So I'm going to talk about the role of the nutrition in dementia, but from the public health perspective. And that is important because this is going to fit the discussion. Before I begin, I would like to disclaim two brief disclaimers. The first one, I have no conflict of interest to declare. And the second one, the views I'm going to express are my own and do not necessarily reflect those of my institution. These are my personal reflection and my personal opinion. So what's the role of nutrition in dementia? Let's first start with what is the role of nutrition. Nutrition in general terms is the utilization of nutrients by the cells so that it functions properly or works properly. When a nutrient is deficient or is in excess, the body activates like a compensatory mechanism to maintain its balance. However, when this state of compensation becomes the norm, for example, when it's iron deficiencies or when excess of sugar intake or excess of fat, it can lead to dysfunction, in this case, metabolic dysfunction, and eventually the onset of the disease. Once the disease is established, nutrition takes on a therapeutic role, supporting recovery, reducing complication, improving quality of life, and in some cases, helping to slow the disease. Say that nutrition is not a cure, but is a critical component of dementia prevention, risk reduction, and care, especially in countries like Mexico and low middle income countries where aging rates and chronic disease are rising. Is projected by the end of 2050 that the largest group of population that is going to grow the most is the group of 80 years old and older. And as we are aging in Mexico, it's not that healthy as we can say. Said all this framework, that's why nutrition is a powerful strategy for disease prevention and it stands as one of the most effective tools for public health. So here are some facts about the role of inadequate diets on the prevention, onset, and progression. Inadequate diet is associated with high risk of cardiovascular disease, obesity, cancer, and type 2 diabetes. The results of some meta-analysis and systematic reviews I'd say that unhealthy diets contribute around 20 to 40% of chronic diseases cases globally, around 20 to 30% of cardiovascular disease burden, and it accounts for 15 to 20% of cancer, certain types of cancer, and up for 50 to 60% of obesity and complication of related to obesity and a similar approach to diabetes. All these conditions share a common feature: the metabolic dysfunction, the mitochondrial dysfunction, driven by insulin resistance and impaired glucose metabolism. Also, all these conditions, obesity, type 2 diabetes, high dyslipidemia or high LDL cholesterol, and hypertension are recognized risk factors for dementia in the 2024 report of the Lancet Commission on Dementia Prevention. However, diet, particularly the unhealthy diet, is not explicitly highlighted as a risk factor. So this submission has important consequences for all those who doesn't work on dementia prevention. It may limit the development of public health strategies that address dietary intervention as a means of reducing dementia risk, despite the strong evidence linking nutrition to metabolic dysfunction and cognitive health. Recent evidence, as you may be aware, has shown from epidemiological studies have shown that the high consumption of ultra-processed foods is associated with faster cognitive impairment and faster progression of dementia compared to those who have low intake of ultra-processed foods. Ultra-processed foods are characterized for being high in sugar, saturated fat, energy dense, low in fiber, and poor nutrient dense foods. So that's why addressing public policies to reduce the consumption of ultra-processed foods could be a key strategy to protect brain health and reduce the burden of dementia at the population level. On the contrary, you may be aware that the mind and the Mediterranean diet have been associated as a neuroprotective diet that delayed the cognitive impairment and is associated with a risk reduction in dementia in certain population. Nonetheless, that's my personal opinion. This is a publication bias. Hispanic or Latin American people has been underrepresented in the epidemiological studies that study the relationship between diet, and the onset and progression of dementia. With the exception of one study in America that is studying the Latino population living in the United States, there is not so much evidence of this epidemiological study studying this relationship. So there is no way to recommend a Mediterranean diet in the Mexican population to delay the cognitive impairment because this diet is not culturally appropriate, is not sustainable, is not affordable, and is not sustained because it's not culturally appropriate. So I'm aware that there is the finger trial in many countries, in countries in Latin America. So we are expecting the result to see how was the adherence to this kind of diet that is mimic the Mediterranean diet in this population, and if it has some impact. So this diet, the MIND diet, is characterized for being anti-inflammatory, and these anti-inflammatory components is linked to the high intake of fruits and vegetables that has a high antioxidant capacity. So what is our recommendation then? From the public health perspective, we need to look at the local diets. All the local diets have functional food that can fit that role. For example, in the case of Mexico, the beans are functional foods that lower glucose spike and improve the insulin resistance. Also, there is another food that is widely consumed in the population that is the cactus. This cactus is similar in the antioxidant capacity to the blueberries, but it doesn't have the same components like the color, but it has the same antioxidant capacity of this kind of fruits. So that's another functional food that adds some health benefits to their diet. And also to crickets, we used to eat crickets like in salads or eggs of ants like is part of the traditional diet. But this element has not been studied on the concept of local diets and in the big epidemiological studies about this relationship. Therefore, we need to examine our local diets, identify functional foods, and move away from ultra-processed food. So the big takeaway for everyone is that supplements cannot make all the work if we want to improve the brain health. We need to move towards healthy lifestyle change and to add supplement when it's needed. Certain brain health condition function certain type certain brain health conditions. Certain type of diet can serve as a therapeutic tool, complementing but not replacing the medical treatment, similar to how the cetogenic is used in managing the seizure and cognitive impairments. So hope this be helpful, and this is my 10 minutes. So please, if you have any question, let me know.
Wonderful. Thank you so much. That was fascinating. I'm interested to know how do those kind of socioeconomic and kind of cultural factors influence nutrition risk? I mean, obviously you're in Mexico. Do we see differences in that? Because the Lancet report that you referenced kind of highlighted that there's a 7% modifiable risk for high LDL cholesterol and only 1% for obesity, and diet's not mentioned at all, is it? It's just the things that result from a poor diet. Do we see
exactly.
do those risk factors change in different parts of the world, do you see?
Yes. In Mexico, it's estimated to account for 54%, and the report is estimated around 45%. So if we address those risk factors in Mexico, around more than a half of the dementia cases could be preventable.
Wow. So I suppose less so than the kind of, some of those other, the social isolation, I guess, because it's a different culturally, a different kind of community things.
Exactly.
And
Yeah.
there is a version of the Lancet report. There's kind of is it a Latin America, or is it, I don't know if it's country specific. There's kind of a version of the Lancet report, isn't there, that covers, I remember seeing somebody present it at, I can't remember her name, at the Trinity College, that when they hosted a Neuroscience Next conference, maybe the year before last. I can't remember. Anyway. So does that mean that do you see a convergence really between this, rather than having specific brain health policies? Do we instead need to get better with our normal public health nutrition policies to align those, to highlight those things?
Yes, definitely. It's ideal as nutrition as a therapeutic tool once you have the disease, but for public health perspective, it's better to fit to a diet recommendation. Otherwise, you're going to have the diet for diabetes, the diet for renal disease, the diet for, and all have this a common feature. So the metabolic dysfunction. So if we work and empower the population and with access to nutritious foods and moving away from the ultra processed food, maybe we are going to have better results in those public health terms.
And this is possibly a question for later, because Raysa, do feel free to jump in on this. Do we find then that the things that we eat are kind of age dependent, that the things that you might be encouraged to eat earlier on in life or in midlife might perhaps change as you get older, or does your diet need to change, for example, once you experience cognitive decline? Can changes in diet influence disease course? Vanessa, you go. So both waiting for me to point.
That's obvious. Yes, I agree that diet can influence the progression and the decline of in the progression of dementia also. So what the role of the diet in those stage is to improve quality of life and to improve the health benefits for the patient. So, and improving that, this is going to relieve the burden of the family also. So it's not only for affect the person, but affect the environment of the family circle where the person living with
So
dementia is living.
in my background reading, I read that there's been kind of these fairly robust connections made between diet, things like ultra processed foods that you mentioned, and I'm trying to read through my notes here, and where I got it, I've got it written down somewhere here. Between cognitive decline, where is it? I can't find it now. That's annoying. I'm trying to remember the point I was trying to make now, was that there are certainly some forms of dementia, aren't there, that would be potentially more impacted. I'm thinking maybe vascular dementia, particularly, where we know that even post-diagnosis, lifestyle changes can make stopping smoking, changing diet can have a significant impact. Is that because is there a connection between diet and inflammation?
Yeah, there is a strong connection between the role of the pro-inflammatory diet and the progression of the cognitive impairment and dementia. So yes, that's why the my diet works very well, because it's an anti-inflammatory diet and antioxidant diet that helps to compensate and the balance in the neurotransmitters in the brain health, and that can the people perform better.
Yeah. We will take a question from the audience before we come to you, Raysa, waiting very patiently. Angelina asks, there are very few studies on diets in Eastern Europe as well. It's unlikely that we'll have the knowledge and expertise to recommend culturally appropriate diets based on scientific evidence anytime soon. What solution do you see to this problem? Raysa, do you want to have a go at that one? Because I'm thinking about this because you're, you've grown up in another part of the world as well, haven't you?
Yes, definitely. I do agree with the point Vanessa made about our diets, our cultural diets play a big role, and sometimes they are missing from the literature. I come from the Middle East. We have a Mediterranean diet. We have one of the healthiest diets. However, our rates of obesity, cardiovascular disease, diabetes, Crohn's disease are some of the top of the world. So we cannot say a diet works perfectly when we know that diet across the world, it's not as much culture alone. It is, I say a lot about the Mediterranean diet. The healthiest element of it is the social aspect of it. The Mediterranean diet is not a diet where you eat alone. It's completely different having a diet. Mediterranean country, you don't have a plate. You have shared plates and you take a little bit of everything. You have a colored plate in the end, moderation and all of that, which we do not see as much in the Western diet. That's more individualized. And that could potentially be, and there's some research already showing that that's one of the biggest benefits of that diet. So looking at other diets, other cultures, I've mentioned that before. A lot of my research into coconut oil started from the culture, from India, from Kerala, looking at their Alzheimer's rates. It started with anecdotal, then looking at the evidence behind it. It went into the clinical RCT aspect. But I think culturally, until we have representation of researchers from across the world and funding that is spread, funding, I would say, that's spread worldwide in a fair way, we will never get clear representation of cultural impact on health and well-being.
Do we know enough? I mean, how comfortable are you in, say, answering a question? Do we know enough to say that there are foods that are definitely bad for you, as opposed to foods that are good for you? Because I think this is one of the things that confuses the public often, is because one day you'll read one. I know this is something that comes up all the time, I imagine, when you do talks, and you must be tired of answering this question. But one week you'll read a paper that says, hey, we should all be eating far more nuts and berries, and then there'll be something about drinking more red wine or eating less. I don't think I've ever read anything that says more ultra processed food is good for you. But I think there are studies that saying, hey, maybe we're being too overly concerned with ultra processed foods.
I think
is that why you shy away from saying do eat this and don't eat that? Because
there's no good or bad food. Sometimes bad food, as people like to put it, a lot of people would tell you a donut is processed, it's bad, it's good for your mental health, it releases dopamine in the body, it makes you feel good, it has a good impact in one way or another. So to me, I'm a dietitian who's happy to say here clearly there's no good or bad food. It's the amount of food we eat, how we eat it, and our lifestyle around it. And many foods were considered bad 10 years ago, now are superfoods. And even with the ultra-processed food, unfortunately, there are some ultra-processed food that are recommended and are potentially good, especially those that are needed by people who are malnourished, have specific needs. They need the ultra-processed foods. And the NOVA classification is the only way we can identify those that can be used to those that cannot. So even saying ultra-processed is bad is not something that we can say, potentially.
And I guess this is where you struggle, because you're both looking at population levels, where in reality, what we're almost needing is something that I know, programs like Zoe have come up with, haven't they? Where in the UK anywhere, where they're saying that actually diet is person specific, that there are some things you should eat and some things you as an individual shouldn't eat because your body can react differently to different nutrition. Is that a misnomer? Is that true? That a diet should be specific to the individual.
There are individualized diets. It exists. It's part of dietary plans. But when you're looking at a public health perspective, which is like mostly what Vanessa's work and policies, we need to take care of the population first, because I don't think any government has the funding to individualize every single person's diet. Zoe itself, with the amount they charge, they can barely do that. A lot of the diets are similar because many needs are similar.
Well, we'll take one more question and then we'll hear from you, Raysa. This question says, is from, let me pop this up on the screen for you, which says, Yingli asks, are there existing studies tracking inflammatory states and cognitive performance of adult populations longitudinally? Vanessa, are you aware of research on that?
I am aware, but I do not remember the author names. So yes, there is the pro-inflammatory index of the diet are being studied very well, and how these are associated with aging outcomes, and among these aging outcomes and cognitive performance. So, but if you can write me, I can track those studies and I can share it.
Thank you very much. Right, that's enough. Raysa, let's hear from you now, and then we'll come back and take more questions and have a chat afterwards.
Thank you. So I'm gonna follow up a bit from where Vanessa started, looking at ultra-processed food, looking at where our diet should impact our health, our well-being. When we're looking at diet, we are looking at prevention, specifically with diseases, as Vanessa said, especially when we don't have a cure for Alzheimer's disease, dementia, for example. We do not have a clear cause and understanding of the disease. There are multiple theories that look into how Alzheimer's, vascular dementia, and different types of dementia manifest in the body, but there's no clear-cut theory that says this is how it happens. And as long as we have this gray area, we cannot have a proper cure for the disease, and that's where we are stuck now, because a lot of medication, a lot of pilot studies, a lot of research is going into different areas, and diet is the same way. So diets look into different aspects of Alzheimer's, of dementia prevention. So looking at that, the two main theories we're looking at with dementia, with Alzheimer's specifically, is tau protein and the plaques and the ketosis, which is the glucose hypometabolism in the brain. And these are some of the two biggest theories at the moment, looking at Alzheimer's development, neurocognitive decline related to aging. So once again, cognitive decline related to aging, we're looking at prevention, we're not looking at treatment. There's a lot of research that went into that. Within that, we all know the Mediterranean diet with its antioxidant, anti-inflammatory, food elements, polyphenols in the food that are good for the brain. They are good at reducing oxidative stress. They are good in improving our gut microbiome and thus enhancing the gut-brain axis, improving our mental well-being, improving cognitive functions of the brain and the whole body, while reducing inflammatory markers in the body. So the Mediterranean diet's been well researched in the area of dementia prevention. There's multiple longitudinal studies. However, the evidence is not all clear-cut. There's a lot of evidence that says there's significant improvement, but a lot that shows there was no change in individuals. And a diet like that is a diet that would be recommended for the entire life of the individual. So doing that a bit later on, when people already have Alzheimer's or already have dementia, or after the age of 65 or 70, might be a bit too late, because we're looking at preventing damage. And at that point, a lot of the damage would have happened, especially in the world we live in at the moment, with a lot of pollutants, with a lot of stresses on our bodies, on our minds, oxidative stress as well, and all of these aspects. So that's when it comes to the Mediterranean diet. It's helpful throughout the lifespan. It's a healthy lifestyle. And as I said earlier, the social aspect of it as well is essential for prevention of memory loss later on, because social aspect of our lives is essential for our mental, physical, and emotional well-being, and it's essential for our quality of life. The main aim of delaying a cognitive decline, of preventing Alzheimer's disease and all of that, is maintaining a good quality of life for as long as we can. And having a good social, physical, mental well-being is a big aspect of that. So we need those diets, the Mediterranean diet, the polyphenols, the fruits, the vegetables, even red wine every once in a while are good. The other theory of research, which is the area I know a bit more about, and it's the area that is controversial by itself, is looking at glucose hypometabolism. And that's what is being called the brain energy rescue. A lot of research has found that as we age, our brains automatically start using glucose less. And that's a normal part of human aging. The way our brains use glucose just declines with the aging process. And that is shown with the amount of glucose used in different areas within the brain after the age of 65, when MRI scans were done for people who were beyond 65, 70, or who had Alzheimer's disease, and comparing them to others. And looking at that, we realized that as our brain needs a high amount of glucose, diets that are not providing enough energy to the body will not provide enough energy for the brain. That's one. And malnutrition is very common cause of cognitive decline, especially in elderly individuals. And then two, it would be any diet that is linked to releasing too much glucose as well in the body. So reducing insulin sensitivity, increasing insulin resistance. Those I'm talking about the unhealthy diets that are based on high sugar, high fat diets, and they can increase our risk of Alzheimer's disease. And that's why in some areas you can see that Alzheimer's is being called type 3 diabetes because of its link with glucose. Its link with how our body metabolizes and uses glucose. There's a huge link between Alzheimer's disease risk and between insulin resistance and diabetes and cardiovascular diseases. So a lot of metabolic diseases. That's why it's not a big shock to know that Alzheimer's disease can be related to neurometabolism. Once again, going back to our metabolism, how our body is using nutrients. So looking at that aspect of glucose, a lot of new research is looking at the use of ketones instead, and using a ketogenic diet to provide the body with ketones, because ketones are used in the body. No matter what age we are, the same way a 5-year-old's brain uses ketones is exactly the same as an 80-year-old. So providing ketones as an alternative source of energy, backup fuel to the neurons, can help prevent this cognitive decline and preserve brain functions for longer. Once again, prevent, preserve, and delay progression. I'm not saying this can ever cure. Diets are to be used along with medication and treatment, and for delaying progression or prevention and not a cure. So looking at ketones in that aspect, that's something that's being researched a lot nowadays. We've heard a lot about the ketogenic diet, looking at it with weight loss, metabolic profiles, epilepsy. You know, ketogenic diet was even created for epilepsy from the beginning. So it's not a big shock that it could be used for dementia, for cognitive decline and cognitive functions. A lot of research into that area is currently ongoing. It's a very active area of research. However, there's a lot of controversy, of course, around ketogenic diet because it is high in fat, and high fat diets can cause a lot of health issues like cardiovascular diseases, increased cholesterol level, and such. Some new research has said that high LDL levels, if people taking ketogenic diet, did not increase the risk of cardiovascular diseases, but that's new research, and we would take that with a grain of salt. I'm not saying it works 100%. I'm saying there's more research coming on about how ketones work and function in the body, because we know that as fats, our body does not metabolize fats the same way, ketones the same way. As well, our genetic profile makes a big difference. However, how our body uses fat is essential to understand what kind of fat we should or shouldn't eat. HDL is essential. Omega-3s, omega-6, we've already always known they're very good for our mental health. They're very good for brain functions, for cognitive functions. And once again, it's all about the synergy of food. It's all about the different diets, the moderation of the diet. It's not one solution. We do not have one answer in the world of Alzheimer's, at least, or dementia. We have multiple theories and multiple things that we say can work or might not work. If you are thinking of a ketogenic diet, or if a ketogenic diet is something somebody's thinking of doing, they need to be aware that a keto diet can be high in omega-3s, omega-6, fatty acids, and protein. Does not have to be very high unhealthy fat. So a keto diet can be healthy diet or unhealthy diet. However, research shows that it can help in that early stage of Alzheimer's, between mild cognitive impairment to Alzheimer's disease, delaying that progression that at the moment we have nothing for. And it can help with people who are older adults, in their later adult years, 50, 60 and above, to kind of maintain their cognitive functions and prevent age-related cognitive decline and memory loss. And maintaining that, the maintenance of a ketogenic diet is questionable for a long period of time. We need a lot more longitudinal studies on that to be able to comfortably say that's something that can be done. However, it's something that's currently being researched, along with the MIND diet, which is a mix of the Mediterranean diet with the DASH diet that looks at reducing blood pressure and increasing healthy food like anti-inflammatory, antioxidant kind of food in our diets. So there's many diets that have been found that work at that point. So beyond having a healthy lifestyle our entire life, or being physically active, socially active, taking care of our physical and mental health, at that point of Alzheimer's or early dementia, there are things that we can think of, things that we can do. And these are some of the diets that are evidence-based, well-researched. MIND, Mediterranean, ketogenic diet are the main ones. A lot of supplements. At the moment, there's a lot new research coming out about NADs and the NAD supplements and how NADs can help with delaying cognitive decline and aging process with their anti-inflammatory, antioxidative, neuronal protection functions. But once again, that's very early stages in the research and nutrition research. Nutrition research in these conditions is very complicated because usually you don't have somebody who has only Alzheimer's disease. You're looking at Alzheimer's along with diabetes, cardiovascular, kidney disease. There's many other health conditions at play, and we need to have a treatment plan that works for all of these conditions, which can be a bit complicated. But for prevention, maintaining cognitive functions for longer, I'd say there's many recommendations. Among them are ketogenic diet and Mediterranean diet. They are the most well-researched ones. I'm happy to take any questions about that. I don't know if you want me to go on a bit more about this, Adam, or do you think that's enough?
No, that's good. We'll have a chat and take some questions. You're interested because I think I already asked this question earlier, but you've kind of reminded me again because we did a podcast a little while ago, a couple of years ago now, with Amber Sewell, who works on motor neuron disease, who said that there was evidence that actually the thing you mentioned there, that our body taking energy from glucose as opposed to fats, that actually there was evidence that in motor neuron disease actually it helped to change diet, actually, that as the disease progressed, there was an argument for saying that moving on to a higher fat diet that had some of those cholesterols in it was better as the disease progressed because it changed. And I guess, has there been research to look at, I know we all talk about a Mediterranean diet and we talk about avoiding dementia in the first place, but is there research looking at how diet should change as disease progresses potentially, and are there foods that can delay onset once it's begun?
There is changes in diets that are recommended as diseases progress. You're looking at multiple things on the disease and the condition. As I said, the main issue with dementia, it rarely ever comes alone. Usually it comes with other conditions. You're never just seeing.
There's Parkinsonisms and Alzheimer's with vascular. They never find.
Metabolic syndrome is common. That is common. I think around 2 out of 3 Alzheimer's patients are diabetic potentially. There's many other health conditions, cardiovascular disease as well. So a lot of these people technically would have been on a healthier recommended diet much earlier than the diagnosis of Alzheimer's disease. That ketogenic diet is in some areas being recommended at that point to change the diet. For example, for Alzheimer's, for neural disease, there's many, well, as you said, they change their diet as well. Sometimes, just like with dialysis, you would give a patient who is suffering from kidney failure a diet that's low in protein. We would do the same with somebody who's struggling with different health conditions. There's a diet for each disease and each stage of the disease. However, we cannot clearly say this diet is fully recommended because, as I said, the research is still not certain, and we cannot people, especially ketogenic diet, if somebody already has vascular disease, hypercholesterolemia, that's a high risk.
And you've got that added, as you say, you've got that added complexity because we know that people living with dementia usually have 2-3 other comorbidities as well, don't they? As you said, they're diabetic, they've got a history of heart problems, they might have other things going on that the diet you change for Alzheimer's might then affect their other condition, which makes all this really, it must be really complicated to do research in this area.
To be honest,
study recruitment must be a nightmare.
No, I tend to work a bit more with more of the mild cognitive impairment because a lot of diet and nutrition interventions work best at that point, which is mild cognitive impairment, mild Alzheimer's. Different countries call it different things. Even in the UK, we found out that different trusts call it different things. Mild cognitive impairment is mixed a lot of times with mild Alzheimer's, or what we call worried well patients, who are patients that think they are forgetting and feel that they're losing some aspects of their memory. Then that's the point where you can do interventions like that and look at
that's I mean, you working in public health, Vanessa, you must find this as well, that's the point when people really are motivated and stand up and pay attention. I know so many people who only made the lifestyle change they needed, like stopping smoking or changing diet, once they'd been diagnosed with cancer. If you'd have asked them to do that years before, they would have been less motivated to that. So what common misconceptions do you encounter? You must both do a lot of public engagement and meet people. What common misconceptions do you encounter the most when discussing nutrition and dementia? Vanessa, what do you? Let's see if there's a cultural difference here. What between the UK and the Middle East and Latin America? What common misconceptions do you come up against?
Well, regarding nutrition and dementia like that, in misconception, I'm not aware of that. Recently, we did a study of focus groups exploring the brain health concept and the diet in relation to this brain health concept, and they were willing to change some habits of the diet to improve brain health. And the willing to change was positive when they have already the condition. And I agree with the comment you said. Once I have a cardiovascular disease, I'm aware that I need to take care of my brain. So there is a positive properties of nutrition regarding the local foods. That was surprising for me because there is local foods in the communities that have good properties for the condition, like these mushrooms. And regarding the unhealthy aspect of the diet, they already said, "Oh, this habit, I have it, and I'm gonna change it." This the soda consumption. So it's not a misconception, but they are aware that this kind of drink it soda often it's not good for their health, and they are associated that it's not good for the brain health.
I mean, so much of this is talked about now, isn't it? I think people generally, do we think people are kind of aware of what's good and bad from it? It's just whether they take any notice of this. But Raysa, what do you find? What are the common misconceptions?
I would say main issue superfoods that are being social media every single time somebody knows I'm nutritionist or I work in dementia research or dietitian, they say, "Oh, have you heard of this new mushroom? Alzheimer's. Have you heard of that drink, that juice?" It's always something new, and I always just look at them. I'm like, no, how can you be a nutrition dementia researcher and not know? This has fixed so many people's lives. And then they go on and on about it. And there's so much misconception around that. They believe a lot of superfoods exist.
Do you know what? I'm a sucker. I'm the worst person for that. Do you know what? You should see my little jar of vitamins I take in the morning, because I buy into that. You know, I started taking lion's mane mushroom like a year ago, and I thought, yeah, I'm sure this is actually making a difference. I feel a bit more alert in the mornings. And
I didn't want to specify which mushroom, but here you go.
The lion's mane mushroom and the little I take it as a tablet. I don't do the tea or the other things. But you mentioned what's that other supplement you mentioned that's getting hot at the moment?
NAD plus now. Yeah,
that's the latest one. And I won't lie to you, I've Googled that in the last month to say, hey, where do I buy this?
Because the thing is, I find it, and people directly reach out to me, what do you think of this one? Have you heard of that one? And I feel like I'm constantly doing research because of that, which is good for me. But some of them are evidence-based. Like the NAD it's now making it to mainstream media a bit more, but it's always been there, and that's something always been looked at. And do you need supplements? Not everybody needs supplements. Your body can create them if you have a healthy body.
That's what I read, is that naturally, because I've been taking a vitamin D supplement. Like,
you need that.
Yeah. Well, that's what I convinced myself as well. I take that through the winter, and I didn't get any colds for 2 years running now. I haven't had a bad cold, and I thought that's why. So why should I'll just keep taking it through the summer. And I did read recently, it's going, you don't really need it so much if you're getting more sunlight. Not that Vanessa has that problem in Mexico.
Surprisingly, yes. Because when we look at the metabolism of vitamin D, and in the evolution, because we have a straight sunlight exposure, a high sun exposure, the evolution make the receptors sensitive, because otherwise you are going to have an overdose.
Yeah, that's fascinating.
Yes. So when we look at the prevalence of vitamin D deficiency, is concentrated more, or the higher risk is around the Ecuador line, because these people have a fail in the vitamin D receptor in the cells, and that is a change or a step in the evolution to not get overdose of vitamin D. So this vitamin D is the main deficiency in older adults, and I think worldwide.
That's interesting. You said. I thought you were going to say because everybody spends so much time indoors because it's so flipping hot outside, so we don't go outside. But that makes sense. I have to say, I'm a sucker for any kind of these things, and whether there's this public psyche about looking for the quick fix or looking for the easy answer, when we know that actually the real solution is to make a much more holistic lifestyle change. It's that combination of drinking more water that we are constantly told that we should be doing, changing diet, eating more nuts and berries, exercising more, and everything in moderation. Don't live on steak and chips every day, and bacon sandwich is good if you can religiously eat that, but don't have a bacon sandwich every morning. It's a treat thing. We haven't got long left, so I just want to remind the audience you are welcome to ask questions. But while we've got time. We can't have this conversation and not talk about Ozempic and Mounjaro, which I'm going to throw into the mix as well, just to complicate things, because of course, where this is the new wonder drug, right? I mean, this taking this means you eat far less. It addresses all the problems. Is Ozempic and Mounjaro a wonder solution? Vanessa was shaking your head.
Definitely not. Definitely it's not. No, there is not. Mexico faced we are leading the obesity rates, and there is not in the complex of the problem. The obesity problem is very complex. It's not the fault of the individual. It's so many environmental factors that play a significant role in the obesity problems. Poverty, access, nutrition, physical violence. We cannot walk safely in the street because of the violence. So it's a complex problem. So it needs to be addressed like that. And this magical treatment doesn't fix the problem by itself.
No. Yeah. What's your thoughts, Raysa?
I agree. I don't think they fixed the problem. I think we are looking at a much, much, much bigger problem in the next 10 to 20 years with all the people who are currently using that. GLP is not a solution, which is what Mounjaro and Ozempic are based on. They are needed by people who have diabetes for a reason, not a human being. And the side effects have already started happening. A lot of people, after stopping them, are increasing double the weight. Quickly, in some studies, people are losing their hair, they're deficient in different nutrients because their metabolism has been impacted. As a dietitian, I always tell people, you cannot impact your metabolism because once you mess up your metabolism, there's no fixing that easily. It's a system that works on harmony. Mess it up, it's going to be very hard to get it back to work properly. And that's what Mounjaro and doing. When it comes to dementia, unfortunately, some studies show that they can improve cognition because they work on glucose metabolism. They increase glucose metabolism in the brain and improve insulin sensitivity. However, I think it could be a bigger problem that we might face.
There's balance. It's always a balance, isn't it? Is the risks of being overweight, what the impact of those, as opposed to then the risks of having this medication. In all transparency, I should confess that I am taking one of those medications. No, but that was a personal choice for me because I've always struggled with my diet and weight over the years, and I've always looked for opportunities to try different ways to help that, and it's helped me. But I'd be lying if I haven't done so much Googling and looking at going, right, okay, so I've lost some weight, what now? How do I cope with this? What are the strategies for maintaining? Do I take this forever, like insulin, like you're shaking your head. I definitely shouldn't do that.
But if you got to a point where people, I think the main issue with dieting, the usual way pre-Ozempic and Mounjaro, is hard because people, when you're not losing weight, you give up. People give up, and then the cycle continues. I think using them, getting to a point where you're happy, and then maintaining that using healthy lifestyle, like physical activity, healthy diet, consistently, and constantly going to see your GP, getting your insulin tested. Or other, we don't know. Research, as I said, shows a lot of people have gained back the weight, some people haven't, but it's just like bariatric surgery. If you don't fix your lifestyle after, you go back.
And that's the stage. I mean, adding my personal part to this. I mean, that's the kind of stage I'm at now, is implementing those things so that I can maintain, I've got to where I want to be. I'm happy. This has been incredible. It's the easiest way I've ever found to get to where I want to be, but I'm worried that sustaining that is nerve-wracking to do that. So just a reminder to everybody watching that we are here. I'm going to ask a couple more questions. We've talked a little bit there about supplements. I'm guessing that supplements have their place, because from what I understand, your body, some things are easier to get into your body via supplements rather than through diet. I mean, are there, but also some companies are then kind of particularly targeting people and marketing and saying, these are the, here's a package, here's a magic pill with all the supplements you need to help cognition. Where do we sit with supplements like that? I remember the drink. Was it Souvenade? Was a drink that was marketed to people, and it's still around. I'm sure I've been at a conference in the last
but it's
12 months
being used in research. I think my friend is currently working on it for TBI, traumatic brain injuries. So they have their place. Does everybody need them? Not really, but some people do. That's where I stand on supplements. Some you do need. I take my supplements. I'm deficient in some vitamins despite having what I'd like to call a moderately healthy diet. But some supplements we need, some supplements we don't. I think marketed supplements depends on how they are.
What about in other parts of the, in poorer parts of the world, Vanessa, where, where food clearly, the range of foods or supermarket. I mean, I said poorer parts of the world. I know in parts of the UK and in the US and things, that getting fresh fruit and vegetables locally is a problem. Is that where supplements can play an important role in those places like sub-Saharan Africa, where we know that dementia prevalence is where we're going to see the biggest rises? What do you think, Vanessa, at a public health perspective on supplements?
You raised something that we are curious for a study, that all the evidence linked to risk factor are coming from developed countries. So the developing countries face another nutritional challenge, like the nutrient deficiencies, and those are not studied very well, and it's not well understood what's the role that plays in the dementia risk in the long term. So yes, definitely, when the people face a higher risk of nutrient deficiency, it's better to supplement if this cannot cover by the diet itself. So there is policies in at least in Mexico, that is, you have iron deficiency and you need to be under treatment. You are vitamin B12 deficiency, you need to be under treatment. So, but only when it's needed. You cannot take it like for granted. When you have 60, you're going to have these multivitamin supplements every day. That's not the way it works.
Yeah.
So, yeah.
Toxicity levels exist as well for a lot of vitamins.
Well, and also as well, we haven't talked about gender differences as well, about the difference between men and women and diet there, which of course is going to add in different factors. Again, I'm afraid that's all we've got time for. I feel we could easily chat for another half an hour. How we wrap these shows up these days is we have trained an AI model on just the content from our website. The Dementia Researcher website, dementiaresearcher.nihr.ac.uk, has almost 3,000 pages of content. This is everything from blogs to webinars to podcasts and articles and opportunities and job listings, funding calls. And one of the things we've done is every one of those has a transcript. So we've trained an AI on just content from our website. So it's learned from everything on our website, not from the internet. And I asked that a question, which is, give me 10 top tips for based on this topic. So I'm going to read out these top 10 takeaways now as a way to round up, and we're going to test you as well and see if these are things that you've also said. So number one was, nutrition is a modifiable risk factor in cognitive decline. What we eat matters for brain health. I think you both said that. I think we can agree on that. Number two, micronutrient deficiencies like iron and B12 can subtly but significantly affect cognition. Did you?
No, I don't think
True.
we mentioned it, but it's true.
Good. So our website isn't lying. Number 3, dietary patterns, not just individual nutrients, shape long-term brain health. So I guess that's eating habits. What time of day you eat, how much you sleep. Do you eat in the morning? Do you exercise after eating or before? Those factors. Number 4, cultural context matters. Diets must be evaluated within the reality of local foods and traditions.
Completely agree. Yes.
Number 5, the MIND diet and Mediterranean diets show some of the strongest evidence for protective effects. I think you both said that.
Yes.
Did. Number 6, early and midlife interventions may be more impactful than late stage changes. I think we all know that as well. Number 7, dietary ketosis may influence memory through energy metabolism and reduced inflammation. Tick for Raysa. Good job. Number 8, public health and personal strategies must align. Education and accessibility are key. You said that too. Number 9, nutrition research in dementia is growing, but still lacks consistent long-term data.
Yes.
And number 10, even small dietary changes like more leafy greens or healthy fats can contribute to better outcomes. So if you're all going to do one thing tomorrow is to swap that packet of crisps or chips, or that's where you are in the world, for a bag of nuts or some dried fruit, perhaps.
Nuts.
No. And don't be afraid of that final glass of red wine. This has been wonderful. Thank you so much, Raysa and Vanessa. This has been a fascinating conversation. I'm really grateful to both of you for taking time out of your day to join us this evening in the UK. And just a reminder for anybody who's watching this now, if you have a question on this topic and you're watching this on Catch Up, Vanessa and Raysa are both members of the community. If you go in there and search by their names, you'll find them. You can send them messages directly through the community, and I'm sure you'll get answers, or do drop a post against the recording here and we'll get answers for you. And do share your own views on this topic as well. We'll be back next Wednesday at the same time, 8 p.m, where we're going to be talking about the coaching mindset. So this is a bit different. Instead of just we're going to talk about coaching rather than mentoring, and how coaching can run alongside mentoring to help with your careers. And we're going to welcome back Professor Michael Colburn from Cambridge and Dr. Kalisha Bonds-Johnson from Emory University next Friday, 8 p.m, to talk about coaching. So do join us then. Thank you very much, both of you, again.
Thank you.
And we'll
Thank
see you next week in the salon. Thank you. Bye-bye.
Bye.